All right, welcome back to the deep dive. We got a ton of listener questions, a lot of material sent in about antibiotics and how they're used in veterinary medicine. Really fascinating stuff.
Yeah, definitely a lot of interest in this.
Yeah, absolutely. Seems like everyone's kind of realizing just how crucial these medicines are for, well, for keeping animals healthy, right?
Oh, without a doubt. And when you dig into it, you see they face a lot of the same bacterial threats that we do. So the parallels with human medicine are really striking.
Yeah, that makes sense. So I guess the most obvious place to start is with, like, treating infections, right? I mean, that's what most people think of when they think about antibiotics.
For sure. And that's a huge part of it, just like in human medicine. Animals can get infections in all sorts of ways.
Right, and we're talking about all kinds of animals, right? Not just like our pets, but also livestock.
Exactly. Respiratory infections are a big problem in livestock. Like, you've probably heard of shipping fever in cattle. That's a classic example.
Shipping fever, right?
Yeah, it's a kind of pneumonia, basically. But then you've also got things like mastitis in dairy cows, which is a really big deal because it can impact milk production.
Right. That affects the whole industry then, huh?
Absolutely.
Hmm.
And then, of course, you have the more common infections that we see in companion animals, like
Yeah.
skin infections, gut infections, urinary tract infections, all that kind of stuff.
Yeah, my dog gets ear infections all the time.
Oh, yeah, that's a classic. But the point is, there's a huge range of animals and infections that we can treat with antibiotics.
Hmm.
And a lot of the antibiotics that are used are actually very similar, if not the same, as what we use in humans.
Oh, interesting. So we're talking like penicillin, tetracycline, that sort of thing.
Exactly, those are some of the big ones. But there are a lot of different classes of antibiotics, like cephalosporins, macrolides, sulfonamides. The choice of which one to use depends on a lot of factors. It depends on the species, the type of infection, and what bacteria is actually causing the problem.
Right. So you gotta match the medicine to the bug, so to speak.
Exactly. It's not a one-size-fits-all kind of situation.
Now, from what I've seen in all this research that we've been doing, it's not just about treating existing infections, though, right? Antibiotics are also used preventatively in some cases.
Yeah, that's a really important point. Sometimes you have a situation where some animals in a group are sick, and you want to prevent the infection from spreading to the rest of the herd or flock. That's called metaphylaxis.
Metaphylaxis, okay.
And then you also have prophylaxis, which is where you use antibiotics to prevent infections from happening in the first place, especially during high-risk times. So, for instance, when animals are being transported, they're under a lot of stress, and that can make them more susceptible to getting sick.
Makes sense. So you're basically giving them a little boost to their immune system, helping them fight off those bugs.
Exactly. Or another example is during weaning. When young animals are weaned off their mother's milk, their immune system is still developing, so they're more vulnerable to infections. So antibiotics are sometimes used to help them through that transition.
So preventative use, treating active infections, it sounds like antibiotics are really, really essential in veterinary medicine.
They definitely are. And actually, there's another way that they've been used historically, which is a little bit more controversial.
Well, yeah, I remember reading about this. This is the whole growth promotion thing, right?
Exactly. For a long time, farmers, especially those raising poultry and pigs, would add low doses of antibiotics to the animal's feed.
And why was that? Like, what was the purpose of that?
Well, they noticed that it led to faster growth and better feed efficiency, meaning the animals gained more weight from the same amount of food.
Interesting, but that sounds kind of counterintuitive, you know? Like, how can antibiotics make animals grow faster?
The exact mechanisms are still not fully understood, but the general idea is that it has something to do with the gut microbiome, the trillions of bacteria that live in the animal's digestive tract.
Gut microbiome, right? That's been a hot topic in human health research, too.
Absolutely. And it seems that low doses of antibiotics can suppress the growth of certain bacteria in the gut, some of which might be competing with the animal for nutrients.
Ah, so it's like clearing the way for the animal to absorb more of the good stuff from its food.
That's one theory. Another is that the antibiotics might be suppressing low-grade subclinical infections that the animal wouldn't even show outward signs of.
So basically, it's like a constant low-level defense against any potential threats.
Yeah, that's the idea. But as you can imagine, there's been a lot of concern about this practice, mostly because of its potential impact on antimicrobial resistance.
Right, AMR. And this is a huge issue, not just in animal health, but in human health as well.
Huge. And that's why this whole growth promotion thing has become so controversial. The worry is that this widespread, low-level use of antibiotics in animals is contributing to the development of antibiotic-resistant bacteria.
And those bacteria can then potentially spread to humans, right?
Exactly. And that's a really scary thought. We're already seeing cases of infections in humans that are resistant to multiple antibiotics. And those are really tough to treat.
Yeah, they're calling them superbugs, right?
Yeah, some people use that term. But the point is, if we keep using antibiotics indiscriminately, we risk losing these vital drugs altogether.
It's like we're running out of options.
That's right. And that's why there's been a big push to reduce the use of antibiotics for growth promotion in animals.
Yeah, I know the EU has already banned it completely, and the US has implemented stricter regulations as well.
Yeah, and there's also been a lot of research into finding alternatives to antibiotics for promoting growth. Things like improving animal welfare so they're less stressed and less likely to get sick.
Right, and better hygiene on farms, I imagine.
Absolutely. And also vaccinations. Vaccinating animals can help prevent infections in the first place, which reduces the need for antibiotics.
And I've even heard about, like, probiotics being used to help support a healthy gut microbiome in animals.
Right, that's an area of active research. But the overall goal is to find ways to keep animals healthy without relying so heavily on antibiotics.
And I think that's something that a lot of people can get behind. It just makes sense from a long-term perspective, right?
Absolutely. And it's not just about finding alternatives for growth promotion, it's also about using antibiotics more responsibly in general.
Yeah, we have to be careful not to overuse or misuse these drugs, whether we're talking about animals or humans.
Exactly. That's where the whole concept of antimicrobial stewardship comes in.
Antimicrobial stewardship. I've heard that term before, but I'm not sure I fully understand it.
Well, it's basically a set of principles and practices that are designed to ensure that antibiotics are used appropriately and effectively.
Yeah.
It's about making sure that we're choosing the right drug, using the right dose, and only using antibiotics when they're truly necessary.
So it's like a more thoughtful, measured approach to antibiotic use.
Exactly. And there are a few key aspects to stewardship. One is accurate diagnosis. Before we even think about prescribing an antibiotic, we need to make sure that we've identified the cause of the infection. Is it bacterial or is it something else?
Right, because antibiotics don't work on viruses, for example.
Exactly. And if we give antibiotics when they're not needed, we're just contributing to the problem of resistance.
So diagnosis is crucial, and then once we've determined that an antibiotic is needed, we need to choose the right one.
Yeah, exactly. And that involves considering things like the species, the type of infection, and the bacteria's susceptibility to different drugs.
And then the dosage is important too, right?
Absolutely. We need to make sure that we're giving enough of the drug to kill the bacteria, but not so much that we're causing unnecessary side effects.
So it's a delicate balance.
It is. And that's why antimicrobial stewardship is so important. It's about striking that balance between using antibiotics effectively to treat infections and protect animal health, while also minimizing the risks of resistance.
And that brings us back to the whole interconnectedness of human and animal health, right?
Exactly. We're all in this together. What happens in animals can affect humans and vice versa.
So it's a shared responsibility.
Absolutely.
Yeah.
We all have a role to play in preserving the effectiveness of these vital drugs.
All right. So to kind of recap everything we've talked about today, antibiotics are clearly very important tools in veterinary medicine. They're used to treat and prevent infections in a wide range of animals.
Yeah, and while the historical use of antibiotics for growth promotion has raised some serious concerns about resistance, there are promising alternatives being explored, and there's a growing focus on responsible use and antimicrobial stewardship.
Right. And I think the key takeaway here is that the way we use antibiotics in animals has a direct impact on human health. So it's something we all need to be aware of and concerned about.
If you're thinking about it from your perspective, the average person might wonder what they can do about it.
Yeah, that's a great point. So here's a question for all of our listeners out there. Considering this interconnectedness of human and animal health, what role do you think individual consumers play in encouraging responsible antibiotic use in agriculture and pet care? Something to think about after this deep dive. Thanks for listening, everyone.